Dr. Nkem Ugonabo, welcome to Inside South Florida.
Thank you so much for having me. It's a pleasure to be here.
It is a pleasure to have you, and we got to talk to you. I mean, now that we are in this winter season, it's getting a little chilly and maybe drier here in SoFlo. So what can people do to refocus on taking care of their skin?
Yeah, well, the winter is a perfect time to just kind of re-emphasize and refresh in terms of skin health. A couple of things you can do, and some of which are easy. One, I definitely recommend focusing on hydration. So you want to make sure that your skin stays moisturized, especially as the temperatures drop. So switching from a lotion to a cream is one practical tip I often tell my patients. Two, you want to continue the sun protection. So people think they can skimp on the sunscreen because it's not as sunny. False. You want to keep up the sun protection. And three, it's a great time to consider seeing your dermatologist for an annual skin check. You can get checked from head to toe very quickly just to make sure everything is in order.
I love it. And your skin is glowing. So I'm listening to any advice that you have, doctor. But what are the latest non-invasive treatments available to help refresh our skin? Going a little deeper here.
Yeah, so lasers are really popular in the winter time, and one particular laser treatment that I like is called Fraxel, and I use it in my office, often, and it is a great treatment. It's safe in all skin types, and it's very useful for different ages as well because it addresses a multitude of issues, everything from fine lines to wrinkles, acne scars, texture, sunspots, etc. And the great thing is it doesn't have a lot of downtime associated with it. So for those of us who need to get back to the office very quickly, it's very useful for that too.
Now, I know that I am very fair-skinned, but what are some considerations for people with darker skin tones?
Great question. So people often think you can't do laser in darker skin, but that's actually a misconception. You can, you just have to do it carefully and thoughtfully, and you have to select the right laser. So one of the reasons why I like the Fraxel so much is that it can be done safely on all skin tones, including those with darker or more melanin-rich skin. It is important, of course, to have a doctor that is comfortable with that because they're going to have to adjust the settings, but all the more reason to see a dermatologist and to talk to them about the laser treatment prior to getting a treatment to make sure that you are eligible.
I love it. Thank you so much for sharing all this great info for us. Where can we go for more?
If you want to learn more, I would highly recommend going to fraxel.com. There you can find a ton of safety information, and you can look up a local provider near you that can do the treatment.
Incredible. Thanks so much for sharing all your great knowledge and hopping on to ISF.
Thank you so much for having me. Have a great day.